Hello, Pittsburgh. I'm Zach Gibson, and this is Trib Lives from the Newsroom podcast, bringing you top stories from TribLive.com. Big changes are coming to Medicaid, and the ripple effects could hit nursing homes, hospitals, and millions of Americans who rely on publicly funded healthcare. President Trump recently signed what he calls the One Big Beautiful Bill. It's a sweeping piece of legislation that trims billions from the Medicaid system over the next decade. Supporters say it's about cutting waste and restoring accountability. Now, critics argue that it puts some of our most vulnerable at risk, especially the elderly and disabled. Quincey Reese joins me today to break down what's in the law, what experts are saying, and what it could mean for families across Pennsylvania. Quincey, thank you for taking some time out to talk to me today. I want to, for a lot of people who aren't familiar, because this has quickly become a very widespread popularity topic, both for politicians to talk about and for people to start looking into now that there are going to be things that may affect them or people they know. So I'm just going to give you some space to go ahead and give us an even starting point for what Medicaid is.
Yeah, absolutely. If there's anything I learned from reporting on this particular story, it's that Medicaid is very, very complicated. There's lots of nuance to it, to the point where the experts that I'm talking to their knowledge of Medicaid is primarily in a niche sector of Medicaid. So there was one person I talked to who, his understanding of Medicaid was mostly surrounding county-owned nonprofit nursing homes, because that's the people and the groups that he advises and advocates for. So it was interesting to learn about. But yeah, basically, for those that don't know, Medicaid is a state and federally funded health insurance program that supports low-income individuals and families. It reimburses healthcare providers, including nursing homes and hospitals, for the care that they administer to Medicaid qualifying recipients. In nursing homes specifically, about 65% of residents rely on Medicaid to pay for their care. So it's a solid chunk of people there that rely on this program. But one thing that I think people maybe don't realize is that there are two different types of Medicaid. So there's the traditional Medicaid for those 65 years and older. That's probably more so the population that you're going to be seeing in nursing homes. And then there's Medicaid expansion, which is for those that are 19 to 64, who of course meet other requirements of the Medicaid program, including income and things of that nature. Both traditional and Medicaid expansion are paid for by the federal and state governments. Traditional Medicaid, at least in Pennsylvania, 56% of the funding comes from the federal government and 44% comes from the state. Medicaid expansion is a lot more reliant on the federal government. 90% of the funding comes from the federal level there, and just 10% from the state.
So first big takeaway for me was the large amounts of federal money. Now, looking at federal money going into this program, it seems like it is a very, if not one of the most present things on the chopping block when it comes to thinning out different processes through the Trump administration's current agenda. So let's move on a little bit and talk about the big, beautiful bill. So what exactly is in Trump's One Big Beautiful Bill that is making Medicaid a forefront of conversation?
Yeah, I think there's lots of different voices surrounding what this One Big Beautiful Bill does for Medicaid, and that's probably what has led to a lot of the different confusion and just opinions that people have about what's happening here. But just to kind of break it down, the White House is saying that the bill, now law, eliminates waste, fraud, and abuse in the Medicaid system by making sure that only those who actually qualify for it are receiving it. The Congressional Budget Office, a nonpartisan agency housed in the legislative branch, says that this law is going to cut more than $1 trillion from the Medicaid program nationwide by 2034. And lots of healthcare advocates, including the ones that I spoke to for this story, claim that the law puts our most vulnerable populations at risk. A Brown University study, for example, identified 4 Western Pennsylvania nursing homes that are put at risk by the law, potentially of closure is kind of what this study is saying. But in terms of what the bill actually does for Medicaid, It implements additional verification processes to ensure that Medicaid is limited to those who qualify for it. It incorporates an 80-hour per month work requirement for Medicaid expansion recipients. So like I said earlier, that's those that are 19 to 64 years old whose annual income falls at or below 138% of the poverty level. And to give a little picture for what this looks like, that would be for a family of 4, an annual salary of about $44,000. Another component of the law is that it's going to decrease the amount of money going into states' Medicaid reimbursement systems for hospitals.
Okay. Now, one of the concerns when hearing about some of these requirements are there's definitely some individuals that are currently part of these things that will no longer be eligible through this verification. Did any of the experts that you spoke to talk about this concern?
Yeah, absolutely. I know the Congressional Budget Office said that they anticipate a increase in, I believe, 11.8 million uninsured Americans, I believe by 2034 through this bill, now law. And several of the other experts I spoke with, one of them cited specifically with the work requirements for those who are on Medicaid expansion, they have concerns that this is going to cause more people to unenroll from the Medicaid program based on what happened in 2018 when the state of Arkansas did something sort of similar to this. At that time, more than 18,000 people unenrolled from the Medicaid program. And also that the state spent about $26.1 million just to implement the policy. So they have expressed, some experts have expressed concerns about the potential cost to states for having to reinforce a policy like that.
Okay. Now, you spoke to a lot of different people covering this complicated story. So what seems to be the general consensus in terms of opinion on what they think the effects, how they think the effects will be received?
I think a lot is certainly up in the air right now. Anytime you're looking at something like this and trying to predict what it's going to turn into in the future, you know, that comes with a bit of uncertainty. However, several of the experts that I talked to specifically expressed concerns with the component of the law that essentially decreases the amount of money going into states' Medicaid reimbursement systems for hospitals. This is a system known as the provider assessment. Mm-hmm. So essentially, states can tax their hospitals up to 6% of their net patient revenue. The federal government then matches that tax, and then all of the money goes into kind of a pot that the state later uses to reimburse its hospitals for the care that they provide to Medicaid recipients. Now that's just for hospitals. A similar system is used for nursing homes as well, mm-hmm. but with a max federal match of 5.6% instead of the 6% for hospitals. Now the one big beautiful bill, it freezes that current federal match for county and privately owned nursing homes, but it scales back the federal match for hospitals and in turn hospital run nursing homes. So that's expected to decrease from where it's at, 6% now to 3.5% by 2033. And I believe it's going to stop there. But this could reduce the Medicaid reimbursement pool for Pennsylvania's hospitals by $4.5 billion over the next decade, according to this Hospital Health System Association that I spoke with. And even though, this is only taking away, on the surface level from hospitals' reimbursements, some of the experts that I spoke to, including Zach Schamberg, who's the president and CEO of the Pennsylvania Healthcare Association, mm-hmm. and Patrick Keenan, who is the policy director for the Pennsylvania Health Access Network, both of them kind of shared the sentiment that any amount that we're taking away from the Medicaid program could impact any specific aspect of the Medicaid system, including nursing homes.
Right. One of the repeated talking points that I've heard when talking specifically about the result of pulling money away is that people aren't going to stop needing care just because they don't qualify for something, or if they can't necessarily afford it. Like in some situations, like emergency services, there's care that will be provided whether the person can pay for it or not. And people that were previously covered by Medicaid that might not qualify in the future, that Medicaid allocation can't fill those gaps where there didn't used to be as many gaps. I think that is a large point of concern for a lot of people. What hospitals will now be forced to adjust to try and come up with the money that they will be losing from those types of credits and allocations. But let's talk a little bit more about nursing homes. They're in the crosshairs of this situation, but can you speak a little more about the current state of nursing homes and how this bill affects this even further?
Yeah, absolutely. That's one of the things that makes this interesting, is that nursing homes are already kind of in a tough situation. We're seeing an inadequate level of reimbursements to nursing homes for the care that they provide already in the Medicaid system. They're struggling with staffing, but at the same time, in recent years, there have been increases to both on the state and federal level, to the amount of hours per resident per day that nursing homes have to care for their patients. So in Pennsylvania, for example, nursing homes are reimbursed $256 per resident per day, which is a $60 shortfall from the actual cost of the care that they provide. And nursing homes are typically these days reduced to a 60 to 80% operating capacity. They just don't have the staff to take in a 100% capacity of patients and meet those increased care requirements.
Okay. Now, hearing that and taking into account that with the resources we already have, things are tight. Losing those resources not only could potentially affect the nursing homes themselves to have to shrink back those capacity levels even further, but for the people who now are past these facilities just staffing capacity, there's a lot more tough and uncertain decisions that the individuals and their families have to now undergo because of the availability or the lack of availability of the option of a nursing home option. This is echoed when speaking with Chase Cannon. Can you tell me a little bit more about that?
So I spoke with Chase Cannon. He's the executive director of the Pennsylvania Coalition of Affiliated Healthcare and Living Communities. His specialty is primarily in the county-owned nonprofit nursing home sector that I referenced earlier. But one of the kind of theories that he mentioned to me about what he thinks could possibly happen with all of these Medicaid changes in the One Big Beautiful Bill is that the decreased capacity of nursing homes might actually lessen the impact of those federal Medicaid adjustments. And there's a lot of different assumptions going on here to, kind of justify this theory. But the idea is that, with work requirements being added to the Medicaid expansion program, that might decrease the number of people who end up enrolling or staying enrolled in Medicaid expansion. Without coverage, patients might opt out of non-critical healthcare services like annual checkups or physicals, things like that. And then in turn, primary care hospitals, clinics, assisted living or personal care facilities, they might see a decrease in patients and choose to reduce their staff to kind of stay afloat, if you will. Which in theory, if you have an increase in unemployed healthcare workers, maybe they'll go to the nursing home sector and kind of bolster nursing homes staffing and allow them to operate at a higher capacity than that 60 to 80% that I mentioned earlier. But even Cannon admits that this is a bit of a stretch. He told me, quote, "Clearly, when you make assumptions like that, there's certainly a degree of uncertainty. It all now depends on what the state legislature does with their budget." But he acknowledged that amid all of the uncertainty about what this law is actually going to do, one of his biggest things is he doesn't want to contribute to some of the fear that people are feeling right now. He said, quote, "My biggest fear is I think a lot of people are scared right now because of the uncertainty, and I just want to make sure that whatever we put out doesn't contribute to people being more scared."
So, Quincey, can you lay out, knowing all of these potential effects, what can the state of Pennsylvania do to try to brunt or lessen the negative impact that could possibly come from these cuts?
So the experts that I spoke with, talked about a couple different things that they foresee Pennsylvania doing to, continue the Medicaid program as the provider assessment is seeing this cut or this reduction. One of the kind of ones that stands out is, the state could raise taxes or divert funds from other priorities like education and road infrastructure, bridges, things like that, to make up for the reduction in federal Medicaid contributions. They could cut services for seniors and people with disabilities to free up Medicaid dollars for hospital care, or they could reduce Medicaid reimbursements to healthcare providers across the board, which, we're already, like I mentioned earlier, we're already seeing a shortfall in Medicaid reimbursements for care. One of the folks I talked to also suggested that, nursing homes could just increase the cost of care for non-Medicaid patients, which would mean that, even though those folks have other forms of healthcare, they're kind of put at a disadvantage in a way. Their loved ones will have to figure out how to pay for that increased cost of care in the latter years of their lives. But I liked the way one of the folks I spoke with, Patrick Keenan, he kind of explained it this way. He said, quote, "When we're talking about taking billions of dollars away from our Medicaid program over the next 10 years, there's no way that nursing homes would not be impacted by that."
Now, the ink on the bill is fresh. It's going to take time to start to see these effects of the bill on the healthcare system, the Medicaid infrastructure, and how that trickles down to individuals here in Pennsylvania. But like he said, there's a lot of uncertainty and no one really knows exactly how things are going to play out. As we've clearly laid out here, the stakes are high. So it's something that is very important for everyone who this affects, or people who you're connected to that this will affect, keeps a close eye on this. So Quincey, I want to thank you for taking the time out to research this story and bring it onto the podcast today.
Absolutely. Thank you for having me.
Thanks for joining. If you enjoyed this week's episode, share the podcast to help keep Western PA locally informed with insightful discussion and the latest news from your area. It's an easy way to spread the word, and it helps our podcast reach more people like you. Don't forget to follow us on Spotify and turn on episode notifications so you never miss new content. Once again, I'm Zach Gibson, and this is From the Newsroom.